got a great group of community citizens with us that are trying to practice social distancing as much as possible, which is what's been proven to really reduce the spread of the virus around the world. So I want to thank our Metro Council President David James for joining us today, along with Council members David Yates and Keisha Dorsey as well. It's important, obviously, that we're all working together to make this virus or this outbreak as limited as possible, so I appreciate the help of the Metro Council. First, I want to give everybody an update of where we are. According to the Governor's office this morning, there are 2 confirmed cases of COVID-19 in Jefferson County and a total of 11 cases so far in Kentucky. What we do know, though, and we want to just prepare everybody for this, is that we will see more positive tests for COVID-19. That's what we're seeing in cities all over the world. We're seeing it in Seattle as well. As I've mentioned several times at these briefings, we have the ability to look at what's happened in other countries and other cities, and for those that have taken precautions and those that have not. Some people are asking, why are we doing all of this? This is an overreaction. Look, we can see what's happened in cities that have not taken these precautions in countries, and there's serious health consequences, negative health consequences happening if we do not act. So that's not made up. That is just what we're seeing around the rest of the world. So it's only prudent that we're doing that here as well. If people want to get a feel for this in America, you can follow the media in Seattle. Seattle, of course, is kind of the epicenter of the outbreak in the United States. So they're like 2 weeks ahead, 10 days ahead of us potentially on their curve. So we don't want to have the challenges that they're having. So everybody, please get informed. That's why we're doing all the things that we're doing right now. And I must say that I am heartened by the reaction of our citizens. And this is evidenced here by the folks here at this press conference here today, where people understand that we are all in this together. Doesn't matter who you are, where you come from, what you look like, what your house of worship is. This is the human race that we're talking about here today. So it's very affirming when we come together and understand that we're all in this together. So thanks everybody for that. As I announced yesterday, I'm canceling all Metro government-sponsored, hosted, or permitted events through April 5th, so people aren't gathering. We're also postponing the annual Give-A-Day week of service, which was to run April 15th to 25th. This is when we're recognized globally as the most compassionate city in the world. Last year, 235,000 volunteers and acts of compassion. So we're redirecting our compassion efforts to making sure we're doing the right things here with COVID-19. I'm also encouraging other organizations to cancel events where people gather in large numbers. Again, the science tells us that's the best thing to do. I appreciate Dr. Polio, the superintendent of JCPS, as well as the Archdiocese, and many of our private schools for following the governor's recommendations that in-class instructions be suspended for the time being. I want to acknowledge that there is a human frustration and inconvenience aspect to this as well. We totally get that. So this is about looking at the bigger picture of how we all stay healthy together. I would like to emphasize again that job one for all of us as citizens of Louisville and the world is when we get up in the morning is to say, okay, what can I do today to help with this public health emergency that we're in? That's job one. Okay, and so anything else that you had, kind of filter it through that job you have as a citizen, and that perhaps will help put any kind of frustrations in perspective. We don't want you. We don't want your great-grandma or grandpa or older uncle that you love. We don't want them getting sick, and we certainly don't want them passing as a result of irresponsible or hapless public health processes. So that's really what's at stake here, is making sure we're doing our best job to take care of ourselves and then being responsible and taking care of others as well. So that's the job of a great citizen and a great son or daughter, father, whomever it might be. So given all that, we really recognize the frustrations that are taking place and that disruptions are being caused to family businesses, but try to keep in mind that big picture there. Part of us as Metro government expressing the awareness of all these issues is communicated through my appreciation in the act of the Metro Council last night, working on a $2.7 million package to provide housing and food aid for families most affected by these sudden changes in the day-to-day life of our city. Most of that money was going to be going to helping us with our pension problem, but this is a clear and present danger on us right now, so it's only responsible to redirect those funds. Also want to assure the citizens of Louisville that we have been practicing responsible fiscal measures over many, many years, so our rainy day fund is healthy at about $74 million. That's in place for emergency situations. We have not tapped into that, but understand that that is available if need be. So everybody please keep in mind we're taking these steps because the best public health information we have makes it clear that they are absolutely necessary. And some people are asking, why are we taking these steps now and when there's only 2 confirmed cases in the city? Well, the answer is, as I've said already, because we know there will be more cases coming. And there'll be, if we're like most other cities, numerous cases coming. Remember, the reason why there's not more cases right now is because there's limitations on the number of tests that are being provided because of availability of tests. And Dr. Moyer is going to talk about that more in a second. When tests become more available, we're going to have more confirmed cases. So just understand that's going to be taking place. So that's one issue. The second issue is, as I've emphasized time and time again, as we look around the country and the world, we see what happens when this disease gets out of control. And so that's the reason why we're taking these measures right now. We've seen in China when the disease got out of control, but then how they clamped down the way that they can in China, then how the disease has then been declining and is now in somewhat more of a stable condition. We've seen in a place like Italy that was not as serious as they now wish they would have been in retrospect, how this is overwhelming the health system in Italy. So unfortunately, as we look at our brothers and sisters around the world, what we're seeing is thousands of deaths, hospitals overrun with patients, doctors and nurses now, then them getting tired, them getting exposed, so they're fighting off illnesses themselves while they're having to make gut-wrenching decisions on who gets care and who does not get care. So one Italian doctor described the dynamic in northern Italy's hospitals as almost a wartime situation. This is a war against a virus where you're really having to think about how you ration health care. Now, we can do something about that if we follow all the warnings that have been put forth and we're coming together like we are in our city to make sure we don't have that type of problem. But I don't want people to think this could never happen in the United States of America. We are at the early stage of this relative to these other countries that are seeing the type of challenges that I just discussed here. So we should not be overconfident. We should not say this would never happen in my city or my state. That is being blind to the facts around the world right now. So let's be aware and have that awareness focused in the determination to do the right thing both individually and collectively. So the bottom line is the more we practice good hygiene and follow the principles of social distancing, the more we lessen the impact and shorten the duration of this crisis. And the more lives we save and the more sickness we reduce. Dr. Moore is going to talk about that here in a second. And let me add that while we're making all decisions based on public health and safety, it's also true and obvious that this crisis has major implications for the health of our economy. We can help with that, though. The longer this crisis goes on and the more events we have to cancel, the more it impacts the prosperity that we've built in our city and the state. So we can lessen that by good teamwork. And that's why the steps we're taking now are necessary right now. And that's why we're asking other community leaders to join us and make these temporary changes, which again, we know are tough, but we're going to get through them. So we've done that through actions like asking our incredible faith community to temporarily forego worship services. I believe the citizens of Louisville know that Louisville is known around the world as a great city of interfaith appreciation and interfaith cooperation. And while we have many different faiths, we have one heart as a city. So we're known for the vibrancy of our interfaith leadership in our community. But we also recognize that when we ask folks to forego worship services, that is a very, very significant request. But what I have been hearing is heartening to see the response of our faith community by them saying this is bigger than any one of our organizations. So the way that we can show our love to each other, The love to the God that we worship is to say we want to make sure that we're preserving our health and the lives of each other. So the work of these leaders in the communities they represent is how we will continue to earn our reputation as one of the most compassionate cities in the world. Moments like this are how we earn that reputation. And it's also how we develop what you've heard me refer to before as our social muscles. You know, when we come together to address crises, and then how we grow in appreciation and love for each other. We saw that when the mosque on River Road was defaced several years ago. The temple, the Hindu temple on Bardstown Road as well. The community has leaned in to those issues and grown as a result of those in appreciation for each other. And that's what will be happening as a result of this emergency we have as well. So our religious leaders have heard the call issued by Governor Beshear and reinforced by my office to suspend worship services for the health of our communities and our city, and they have responded. They're demonstrating that caution and compassion go hand in hand in providing a tremendous example of wisdom, leadership, and citizenship. So on behalf of the people of Louisville, I want to thank all of our religious leaders for their strong decision-making and the encouragement and support of their communities as well. There are other ways that we can reach out to others during this time. I now would like to turn the podium over to Dr. Muhammad Barber. Dr. Barber is a national champion in compassion and interfaith activity. We're just fortunate enough to have him as a citizen of our Louisville, and he's also the chairman of Compassionate Louisville. Dr. Muhammad Barber.
Thank you, Mayor Fischer. Preserving and protecting human life is essential tenet of every faith tradition that takes precedence over other acts of worship. These are difficult times, and yes, our faith traditions call on us to get together and pray whenever we have a tragedy or a difficulty. Coronavirus, COVID-19, is different from any other form of tragedy that it spreads through crowds and through gatherings. So that's why many of our houses of worship from different faith traditions have decided to cancel their worship services. It's not easy, and I really appreciate all the faith leaders who are here to be the first one in their faith traditions. And we hope that our houses of worship who are planning to continue with their services will reconsider their decision. And if they go ahead with a religious service, then they will follow the CDC recommendations of thorough hand washing, maintaining social distance, and more importantly, encouraging their congregation members who are sick to stay home. Especially, we need to safeguard our elderly population, people who are over 60 years, and also people with chronic illnesses like diabetes, heart disease, lung disease. They should be encouraged to stay home and could attend services via webcast or other virtual means. This situation is developing. There's a lot of unknown there. But as a physician, as a person of faith, it's better to be safe than sorry. We know that how rapidly this virus transmitted and spread across Italy. My parents live in Denmark, a small country, and I was talking to my mom and my brother, and there are over 500 cases all of a sudden in that small nation. And all of their schools and kindergartens are closed. And they have requested any gathering over people of 100 that it should be discouraged. And from Monday on, it will be not a recommendation, it will be by law. So I think that our country and our nation, we need to be more vigilant. Yes, we should not be fearful, but we need to be vigilant, and we need to make sure that in next few weeks, if we follow the recommendations of our leaders, because I believe that our local leaders, Mayor Fischer and Governor Beshear, have been on top of it, and they've been very proactive. So I think we need to follow their recommendations. And also we need to remind each other as common citizens that COVID-19, coronavirus, does not differentiate among its victims on the basis of race, religion, gender, or sexuality. It affects those who are most vulnerable in a society, like elderly, homeless. So yes, in these times of crisis, we are there for each other and we are giving hand to vulnerable population, but we need to make sure that even during good times, that there should be social justice and equity in all corners of society. In the end, I would like to give a shout out to one of the local Islamic centers that while all the mosques were debating, Guiding Light Islamic Center was the first one who canceled their Friday prayers. And because of their leadership, it acts as a catalyst and other mosques follow their suit. So I hope that every citizen will take their individual responsibility, because this is our moral duty, not just for ourselves, but it is also for the sake of community at large, to follow the recommendations, to make sure that we contain this virus so that within a matter of couple of months, we all can move on to our lives. Thank you so much.
Thank you, Dr. Barber. Dr. Barber is also a geriatric specialist, so he's right in the middle of this from a healthcare delivery standpoint as well, so we appreciate that. I also want to thank, Dr. Barber talked about our imams today, so I want to thank our imams with, kind of the rhythm of worship, if you will, starts on Friday with our Muslim traditions. Saturday with our Jewish traditions, Sunday largely, with our Christian traditions, and then, we repeat throughout the week at different days. But I'm very pleased that Rabbi Chotner is here with us today from Temple Shalom to share a few words with us. Rabbi?
Thank you, Mayor Fischer, for your leadership and for holding today's press conference. And thank you, Dr. Barber, for inviting the Jewish community to be part of today's press conference. We are fortunate to be part of a community here in Louisville where faith communities are being proactive during the COVID-19 pandemic. In keeping with Governor Beshear's request to cancel religious services, and then echoed by Mayor Fischer, coupled with the Jewish value of pikuach nefesh, saving a life, we have decided to temporarily suspend our worship Sabbath services. However, being that God is omnipresent, we know that we can connect with our divine Creator in our homes when it is not prudent to gather in our sanctuaries. We pray for the doctors, nurses, and caregivers charged with helping those who are ill. And we pray for a refuah shlema, a complete and thorough recovery for all those who are currently sick. We also pray that through cautious measures, as outlined by the CDC, the majority of Louisvillians will remain healthy. I'm grateful to live in a city where faith leaders come together regularly to support each other, both during times of difficulty as right now, as well as during times of celebration. May God watch over us and protect us as we continue to watch over and protect each other. Baruch atah Adonai, Rofei HaCholim. Blessed are you, Adonai, the source of healing.
Thank you, Rabbi. Our Festival of Faiths is a quarter of a century into its wonderful run, as being recognized as one of the tremendous expressions of interfaith throughout the world. So Sarah Reed is with us here today to talk about the Festival of Faiths and representing the Center for Interfaith Relations. Sarah?
We just this past week made the very difficult decision of suspending or postponing the Festival of Faith until times are more certain. But we are very much part of this interfaith community and our much beloved faith leaders that are standing with us. And as the world responds to this pandemic, we are reminded that we are interconnected and the importance of cooperative action. Let us use this opportunity to show care and concern for the well-being of our brothers and sisters, who are sick in Kentucky as well as around the world, and to reflect on our shared responsibility in this effort. A common thread among the faiths is the understanding that we are in this life together, for better or for worse. Accordingly, faith can sustain and comfort us in difficult times and inspire us to common action and to compassion for all humankind. Louisville is very lucky to attract a diverse influx of smart, interesting people from all over the world for meetings, for jobs, for conventions, for festivals, and travel. And there is no question that our lives are better because of this interconnectedness. That being said, we must acknowledge the seriousness of this current situation and to heed the advice of officials like the mayor and our governor to minimize the harm and show care and concern for our neighbors. Fortunately, even as we deal with this uncertain time, the modern world offers us ample ways to stay connected, even when we cannot be connected in physical presence. I encourage you to take advantage of all the virtual opportunities offered by our many diverse interfaith communities. Perhaps as we prepare for a period of quarantine and containment, we can use this time to turn off the distractions and the discouraging headlines, take a pause, nourish our hearts and our souls by utilizing the many online resources offered by our diverse faith communities. If perchance you have a faith community that is not virtually accessible, I'll offer the Festival of Faith's YouTube channel, which has over 300 samplings. Many people on the stage have been part of them, as well as people from all over the world. And again, I just ask you to take a moment to feel the ways of positive connectivity in this terrible time. As a community of many faiths and one heart, let us pray for those who have contracted this virus and to those who are working to combat it. Thank you.
Thank you, Sarah. I want to emphasize to people, too, get outside and enjoy Mother Nature, okay? Take a walk. There's a difference between being isolated and quarantined. But unless you're in isolation, get out and enjoy Mother Nature. Keep your distancing at the same time, but get your fresh air in. Okay, I want to talk a little bit about the job of city government here, transitioning to another topic of this press conference right now. I mentioned earlier in the week the need to address some internal issues to make sure that we were continuing to deliver essential government services, all government services by Louisville Metro government. We want to be able to protect the health of our employees while we do that, obviously, while we continue to take care of our citizens. And as I said a couple of days ago, the nature of city government and the jobs in city government are very, very different, from 24/7 public safety officials to people that are in Office of Management and Budget doing back office billing. So we have to have some discretion by departments on how we do this. My human resources team has developed an emergency paid sick leave policy for employees who are in medically directed isolation, as well as greater direction on telework and other workplace options. And we'll be sharing that document with the public. Secondly, I signed an executive order today that allows us to make these kind of changes and helps to mitigate any negative impact on Louisville Metro government as it relates to the coronavirus. We'll make that document public as well. And finally, I'm announcing that our Department of Resilience and Community Services will be providing, over the next 3 weeks, 26,000 frozen meals to people over 60 starting on Monday. So we'll be distributing them through 5 community centers throughout the city and the East Government Center. Excuse me, it's starting on Tuesday is we're going to do that. So starting on Tuesday, people can pick up 5 frozen meals at a time, take them home, and then prepare them throughout the week. Then come back the following week, pick up another 5 frozen meals. And we'll be following best practices for hygiene and social distancing during the distribution process. People can get more information on this at 574-5050, 574-5050. And I really want to thank our partners at Dare to Care, Stan Sigwald and his team with Dare to Care, and Brian for their help with all of their efforts. So Dare to Care is with us so much in our community for food security issues. So we'll be working with you all a lot during this. So thanks to the Dare to Care team. Earlier today, earlier, you're hearing this from me quite a bit, actually. If you haven't figured out yet, I think everybody should take this very seriously and practice social distancing and some of these basic public hygiene practices. The work of our Public and Health and Wellness Department has been unrelenting during this week and past weeks to prepare for this. So I'd like to thank Dr. Sarah Moyer, Dr. Lori Kaloya, the whole team with our Public Health and Wellness Department, and now Dr. Moore has a few words to share with us. Dr. Moore.
So I know many of you are feeling very anxious and worried, and then others of you think we're really overreacting. Just want to emphasize that this is a global public health emergency, and we need to act now. So just want to explain, just like the mayor did again, why you're seeing all these closures and cancellations of events over the country, and why we're making the bold recommendations that we are making. Simply put, when we stay away from each other, we can stop the spread of disease. Viruses need hosts to continue to spread. So by doing these things now will help us avoid extreme situations that other states and countries are facing. So like just 2 weeks ago, Italy was in the same place we are right now, and so this is what we're trying to prevent going forward. So recommending canceling and postponing events, meetings, churches, public gatherings, schools, recommending that everyone that can work from home, and that everyone over 60 and those with chronic medical conditions, no matter your age, stay home and separate yourself from kids and others that might have mild illness and not realize it. So I can't emphasize this enough. The people most at risk of getting ill and possibly from dying from COVID-19 are people over 60 and other people with chronic medical conditions. So our goal is to keep our valuable healthcare providers, cleaning staff, first responders, food providers, and others providing essential services healthy and able to help us all. And for them, our guidance is to please stay home if you are sick, wash your hands, don't shake hands, and keep practicing spacing at least 6 feet between people as much as possible. And so for everyone, what you can do to help us control this pandemic, if you have emergent health conditions, seek care as you normally would right now through the ER or your doctor's office. But if you are mildly ill with fever and respiratory symptoms, you do not need to see a doctor. Please stay home. And if you're, repeating that, if you're sick, stay home. You don't need to, and please don't go out in public. If you're unsure about where you are on the spectrum, you can contact your health provider by phone to get further guidance on what to do, or online visits as well. Testing, while increasing daily, is still limited and is only being done most sick in the hospital and on direct contacts to cases that the health department has identified. The health department is not providing testing, but we are working with those confirmed cases to identify people that meet criteria for being a direct contact. And then also just want everyone to remember to practice good self-care and keep your immune system healthy. That will help you fight COVID-19 when you probably will get it. So first, make sure everyone has a flu shot and a pneumonia shot if you haven't had it yet. And while these don't protect against COVID-19, preventing other infections will keep your immune system healthy and prepared to fight COVID-19. Limit news media to reliable sources and only for an hour a day. There's really good studies that show that if you're on news media too much, more than an hour is known to cause anxiety and stress that wouldn't otherwise be there. Get plenty of sleep. Everyone needs 7 to 8 hours of sleep, at least, kids even more. So please make sure you are getting that. Eating healthy and exercise are also really, really important. The mayor mentioned, get outside, enjoy the parks, go for a walk. Please get the exercise that you need to stay healthy. And then expose yourself to things that make you happy. Music, comedy, socializing on the phone with friends and family are all really important to make sure you stay up. And then lastly, just most importantly, wash your hands. Don't forget that. So thank you. I'll turn it back to the mayor.
All right. So be happy during these difficult times. Okay, as I mentioned, I really appreciate the partnership with the Metro Council. Metro Council President David James is going to share a few words with us.
Hello, everybody. I just want to reiterate and thank Mayor Fischer for the work that they have been doing. When Councilman Hollander and Councilman Winkler and I discussed initially the $2.7 million in order to help the citizens that find themselves hurt by this, we immediately contacted the mayor's office and said this is something we really want to do, and they worked with us immediately to try to work a plan together to distribute those funds and to use those funds if we need to do that in order to help our citizens. And so I want to say thank you, Mayor Fischer, for that. Secondly, I'd like to say thank you to Dr. Moyer. She has received more than enough text messages from me after midnight asking questions, and she provided answers, and I want to say thank you to that, and thank you for your team for all the work that you've been doing. The conversation of social distancing is something that we're going to do next week on the Metro Council. We have members of our council that are at extreme risk and have received information that they should not be out in public during this emergency. And so we will have our first Metro Council meeting as a virtual meeting. And we tested the system this morning. It appears to work. And so it will be an experiment, and we will see how it goes. I'd like to thank Councilwoman Dorsey for all of her work in doing that. And she, too, is a after midnight texter. But we are getting that together. But I'd also like to remind everybody that this is a public health issue. And what that means is that we are responsible for our own health, and we have to work with each other by following the recommendations that the mayor's made, the governor's made, the CDC has made, in order to keep all of us safe. But that also includes that we have to prepare for the future. We can watch what has happened around the world, and we can see what's coming our way, and we should prepare for that. I didn't see Councilman Hollander over there. Thank you, Councilman Hollander. We should prepare for that, and we should understand that this gets worse before it gets better, and that because of the restrictions of the CDC on who gets tested, it doesn't mean that we simply have 2 cases in Louisville. It just simply means we have 2 cases that were confirmed in Louisville, and there's a big difference. With that being said, I'd like to say that we all need to work together and to make sure that we all are safe together. Thank you. I'm sorry. And next, I'd like to introduce to you Councilman David Yates.
As I sit on the stage, or stand, I look around and I see a lot of leaders who spent hundreds of hours trying to minimize the impact that we have on our community. Thank you. It's said that a leader can be defined by how they respond in times of crisis. I think the same is true to a community. So people are asking me, what can I do? What can I do to help? My answer is first, stay informed. Be responsible and follow precautions for yourself, for your family, and for your neighbors. And second, as time comes on in the next week, maybe weeks, check on your vulnerable neighbors. Those that you know that may need something, that may not have the basic necessities. Check on them. Take the time to do so. And third, some of our good citizens, we're going to call on you to help. You see, government can't do everything. In order to properly respond, we would need the help of individuals. I talked to the area community ministries today. They're going to need help. If you would think about potentially volunteering your time, food, money. We're going to have to get meals to people delivered. But I believe that we will be defined as a community because we'll come together and we'll tackle this. Thank you.
Okay, thanks everybody. We've had a couple themes up here, but obviously it's natural for people to have questions and concerns. So what we feel part of our job is here is to answer as many of these questions as we possibly can, be as transparent as possible as well. So in that light, tomorrow we will be inviting residents to participate in a virtual town hall to address some of these questions and concerns. So we'll be sharing details of that event with the media later today, but we want people to have the opportunity to ask their questions and kind of see government in action here as we respond to some potential issues out there. So more details on that later. Okay, so again, we expect to see more cases. We'll get through them all. And we've been preparing for this since January in our public health department. So we were hoping it wouldn't come, but just like every city in the world, it's coming to Louisville. So what's most important for the city and our residents is to take the basic health precaution steps that everybody's heard. The goal is that all 770,000 people will be able to tell us what these steps are by the end of the day. And we all know that step number 1 is to wash your hands. That's right. And avoid touching your eyes, nose, and mouth. After that, cough or sneeze into your elbow or a tissue. Avoid contact with sick people. Okay, and if you're sick, please stay home. Let people know, but you've got to exercise individual responsibility there. I'm still surprised at how many people are shaking hands. As I'm out in the community, some people are kind of laughing this off or they're being macho about it. The virus doesn't care about any of that, okay? So you're not doing anybody any favors by, thinking you're tough that when you're shaking hands or thinking this is some kind of plot of some kind. So bump elbows, okay? It works, so please do that. Good elbow bump. Put a little style into it if you want. I've seen now we got some, 1, 2, we got to, turn around, little side kick, something like that. So you can use your creativity with it if you want, but don't shake hands. And if you have any questions, please call the Kentucky Coronavirus Hotline at 800-722-5725, or for definitive information in the states, you can go to kycovid19.ky.gov, okay? So everybody, please take this seriously. Stay informed is the best thing you can do. Help people. That's what we know how to do here in our city with our values of hospitality and compassion. We do a good job every day in our community on this. So in closing, I just want to say that while it's a good idea to keep a physical distance between us, we can and should stay connected to each other. You heard that from Dr. Moore. You heard that to various speakers up here. We are social creatures by nature. We just got to have a little social distance right now. But there's still an awful lot of ways that we can talk to people over the phone, FaceTime, whatever it might be. So just stay in touch that way. And remember that every household in our city and households around the world are having some version of this same conversation. This just isn't a Louisville thing. This is a global thing that's taking place. So let's use this as an opportunity to reconnect with each other and think about the shared humanity that we all have, and think about this shared appreciation we all have for the different faith traditions that we have that connect us all as one beautiful species of humankind. Especially as we're doing that, keep in mind elderly neighbors or relatives. Ask them how they're doing. Some of our older citizens that are watching too much media, are very concerned about their well-being because they rightly know they're in that vulnerable population, but they can still interact with folks. They can still go out to the grocery at the appropriate time, just practice all of these health practices that we've mentioned there. But let's, in particular, be aware of the concerns that some of our vulnerable and elderly populations are having. Acknowledge that and help them work through that.
Some cities across the country are putting moratoriums on the disconnection of water services and other utility services, and also on evictions. What are the plans here in regards to that?
We're very concerned about any kind of economic consequences right now that could result in discontinuation of services, whether it be water, whether it be heat, whether it be a landlord evicting someone. So we're working with our county attorney right now to understand what our flexibility is in that area. But for issues that we control, just like with paid sick leave, we'll be working through those things. So we're sensitive of where we're developing what our protocols can be.
There have been many national and international stories about people who have all the symptoms of COVID-19, but they don't meet the CDC criteria for testing, and then they're obviously concerned. Now, locally, we're hearing a story about a student who had contact with a high-profile athlete who tested positive and was not tested. I wonder if you could comment on that case, and also what is your message to folks who are going to have COVID-19 symptoms but are not going to be able to get tested?
Yeah, I know Dr. Moore is more informed about that case than I am, so I'll turn it to her.
For the first part and the most important part, if you think you have COVID-19 symptoms, please stay home until the symptoms are gone. I mean, I think it's reasonable to say any illness, but especially if you think you have COVID-19, just stay home until your symptoms resolve. And so that's what we're recommending to everyone. That's why we're taking such drastic measures. So that I hope that answers your question.
Importantly, what would you, people are going to be very, what's the right word? They're going to be scared. They're going to be wondering, wait, why am I not being tested? What would you say to somebody who gets upset, angry even, is what I understand a lot of these people, their emotions are going through, to those people's anger and frustration that they're not being tested?
Yeah, testing wouldn't change and management at all. And so if you think you have it, I mean, stay home till you're not sick. There's no medicine, there's no cure. And so testing might make you feel better, but it's not going to change anything that we would do medically.
And can you comment at all on this case of the individual here in town who's had contact?
Yeah, well, just know that my team is in contact with all the health departments across the state where there are direct contacts, and people who are identified as direct contacts are getting tested. Yeah, Mayor just asked me to clarify, if you have mild symptoms, stay home, like normal cold, flu, that you don't need to seek medical care to go to the emergency room. But if you are critically ill, please still seek medical care. We prefer if you call ahead so the hospital is prepared, because they're separate procedures if you think you have COVID-19, and same at hospital offices. But if you have just normal cough, fever, otherwise feeling okay, please stay home. Do not go around anyone else, especially people over 60 or with chronic medical conditions.
Mayor, you may have touched on this earlier. The governor today announced the closing of senior centers across the state. What's the city doing to help mitigate the impact of that?
Okay. Yeah, so that's the purpose of our meal distribution that we talked about, that will be at our 5 community centers and then one other center that will be starting on Tuesday.
And one other question. This is going to have an impact on the tourism industry. It already is. Talk about the impact of that on the city, and whether that kind of thing can be made up, and how it impacts the city budget.
Yeah. No, the economic impact of this obviously is, we're already feeling it around the country, and as different cities and states take actions like we're taking here in Louisville, Kentucky, it's going to get more severe. The size of this economic impact is yet to be determined, but we know it's going to be quite large. Tourism industry in particular is feeling it. Obviously, we're moving up toward Derby season, so it's something that we're thinking about quite a bit. There needs to be a sound economic package put together by the federal government that addresses people that are most impacted by this. And so we're hopeful that the deliberations between the Congress and the White House now will result in something that the people of America can look at and say, that's fair. That helps people that are really being most impacted by this. So a lot of that's TBD, right, on terms of how long this is going to take place as well. And then what our recovery looks like. Is this the beginning of a long recession, or is this just kind of a temporary blip for a couple months and we'll spike back up? So you covered the economy quite a bit, so I know that you know all about that. So we're just at the local level, we don't have the kind of money that is needed to really have a federal response. As a matter of fact, at the local level, what we do is we get basically what we call unfunded mandates. What the federal government used to cover, like for instance, affordable housing. Affordable housing has been cut 90% over the last several decades in terms of funding by the federal government. So that all rolls down to the city, where then we're supposed to deal with issues like this. So public health investment, the same thing. I do hope one of the things that comes out of this is people's appreciation for the need to invest in issues like public health and basic science research that for too long now our country has said, well, it's not really that important. We're seeing now how important it is to be ready.
Mayor, do you have any employees in isolation? Or?
Let's see if anybody else has one.
Mayor, there was a report that Baltimore police are ordering special equipment and issuing special guidelines for police officers who may come in contact with people who have the coronavirus. Do you know if Louisville Metro Police is planning on doing something similar?
I know that our EMS team and Louisville Fire is assessing some situations before they go into them. Does anybody know here about, is LMPD taking the same, Ellen, do you know, is LMPD taking any of these precautions?
They are taking them, and they have also ordered additional equipment.
Okay, so LMPD is also taking those precautions and ordering additional equipment to deal with folks that are infected with the virus.
Thank you, everybody.
Mayor, do you have any employees in isolation? Have any employees been tested? Have you been tested?
No, I have not. We don't have any employees in isolation.